right, I'm going to show you the daily routine for the phase 2 of corrective care. We're going to add in the extension exercises and the extension lumbar traction. At this point, you've already gone through the phase 1 of corrective care. You're out of pain, or about the 2 to 3 level, of 10 being the worst as far as pain. You've actually started your daily exercises, and you've had no problem with the daily exercises, and you've been performing those daily exercises to strengthen, stabilize, and stiffen up the spine for about 6 to 12 weeks. So now the next thing we want to do is start gradually adding in the extension exercises, which is going to be a modified cobra and the extension lumbar traction. So let's go ahead and do that right now. So you perform your warm-up exercises. Now you're going to go into the extension exercise, the modified cobra. So what you want to do is get on your stomach. You're going to bridge yourself up into this cobra position so your elbows are underneath your shoulders. And you want to brace abdominals. So you want to brace abdominals like you're getting hit in the stomach, and you want to contract the glutes. In other words, you're tensing up your whole body. You want to tense that up for a good 30 seconds. After 30 seconds, you're just going to go ahead and relax. You can bring your head down. And then you want to repeat this 3 to 5 repetitions. And this is always done before you do the extension lumbar traction. Now, for some reason during this extension exercise that you start getting tingling, numbness, or you just get a flare-up with pain, well, you're going to have to modify it. So you go at a lower level. Modify it by just resting your chin on your hands, and then you want to go ahead and go through the same bracing. So you brace abdominals and the glutes. Do that for 30 seconds, 3 to 5 repetitions. You can scale this up by just making fists and gradually increasing the extension. Do the same thing as far as 30 seconds, 3 to 5 repetitions, till eventually you get into this modified cobra position. Now, once you finish extension exercises, now it's going to be warmed up, ready to go for the extension lumbar traction. The extension lumbar traction, you want to get a rolled up towel. You want to do this about 4 to 6 inches in diameter. You tape it up so it's nice and firm. And then you place that towel right under the level of your belly button. Bend your knees, and you want to open your chest so keep the back of your palms on the floor. You start off at about 30 seconds to a minute the first day, and gradually work up little by little until eventually you get up to about 20 minutes a day. We're doing that passive, just lying on the towel, so you can start gradually stretching out that anterior longitudinal ligament. So I'll start restoring the curve of the lumbar lordotic curve of 35 to 40 degrees. The goal is that we want to get as close as possible at 35 to 40 degrees and maintain that curve. Now, if you start getting tingling, numbness, or weakness, or some flare-up with pain during this traction section, then you're going to have to scale the towel. So you're going to, instead of going from 6 or 4 inches of diameter, you have to go down to maybe 2 inches, even 1 inch at first, and just gradually work your way up. It's not where you're at, it's what direction you're pushing that spine. So if you keep pushing it into that lordotic curve and give the body enough time to readapt, over time, gradually it will start readapting. So once we get up to that 4 to 6 inches of towel diameter, be able to stay in that position for 20 minutes at a time, no problem. Now it would be time to increase the intensity of that. So that's when I'd use an orthotic block. It's called the Denero, and it has special cuts in that block to where you're going to place it specifically on the vertebrae for you, so it fulcrums off the area that you need to in order to restore that curve maximally. Now, in order to find out that information, it's important to get an x-ray. The best way to do that is to go to someone who knows more about how to fit these blocks for you, because you want to be able to fit that perfectly for you. So you go to a chiropractor who has knowledge of chiropractic biophysics and how to place these blocks. So chiropractic biophysics, or CBP. So that's a structural rehabilitation program based off more than 150 peer-reviewed journals. So if you go to one of those doctors, they can take an x-ray and they can place this appropriately for you. Now I'm going to show you how that looks. So for myself, I would be placing this block. I'd be placing that right at the bottom of the lumbar spine, and I'd work up the same way. After I've done the towel, I'd go ahead and work up 30 seconds to a minute on this block, gradually work up until I get to 20 minutes at a time, and I'd sustain that for about 12 weeks. After 12 weeks, I'd want to see what type of progress I can monitor objectively. The progress, I'd go back to that CBP chiropractor. They'd take a lateral picture of my spine so they can measure out the change. So how long should you, how many months and so forth should you be doing this type of traction? It really depends on the level of your degeneration, how serious your problem is, because everybody is different. It can take some people a year. Some people, it could take 3 years. But remember, it's not where you're at in your care. It's a direction that you're heading. So just hang in there. Healing takes time. So if you keep consistently doing that, the body adapts over time to where you can change that spine and actually get your maximal correction. Once you've met your maximal correction of your phase 2 of spinal rehabilitation, then you want to move right into the phase 3, which is more maintenance. With the maintenance, you're still going to do your daily exercises, still going to watch all the activities of daily living with your postures, the way you sit and stand and sleep and driving your car and lift. Make sure that you're careful with that. And with your traction, you'd probably do that anywhere from 1 time a week to 3 times a week. And you want to keep sustaining that, because we're putting ourselves and subjecting ourselves in an environment that has a tendency that works against your correction. So keeping on with your exercises. So the body does take time to heal, and it needs some sort of stimulus in order to push it back into the right direction. So just hang in there. Healing takes time.